You look at this now and you go, well, wait a minute, that was a red flag, this was a red flag. That's with 2020 hindsight. But at the time, he's the authority, and he's in this environment. He's in this medical center.
Correct.
And all of these things endorse him and say, this is okay. This is a good guy. He's licensed. He's at a big medical center. The university obviously should maintain vigilance and due diligence on these people. And so you're thinking, well, am I just being hypersensitive here? You start to question yourself if you do begin to feel uncomfortable, right?
Well, I'd also add that most of us were raised to believe that doctors are always there to help you and they know better than you do, and to expect some pain or discomfort, whether it be a shot when you're a young child or whatever it may be. So we're already raised to go into a doctor without questioning them. And when you go in and you feel a little bit uncomfortable, it's okay. This is still a doctor and you trust doctors.
Even one of the first conversations with him, well, you've been sent to me because I'm the best of the best. So we are in a vulnerable position. We're patients. We're desperate for answers. We're scared. And he did come so highly recommended. And he was very adamant about being the best of the best. So you put your trust in somebody and you feel, okay, maybe the pain is okay. Maybe I'm just too sensitive, or he would make comments about it being my fault that I was in pain. My anatomy wasn't proper. Right. It was my fault, just deal with it. And made me feel like there was something wrong with me, to where I would actually apologize to him.
At one appointment, he actually asked, you came in and you were wearing some boots one day, some black boots.
It was actually 2 appointments.
2 appointments?
2 appointments.
And what did he
One was
say?
a pair of red high heels. My second appointment was my last appointment with him, which was the truly horrific assault. I was wearing a pair of knee-high boots, and I was also going through some other medical conditions at that point. I thought he had my best interest at heart. When I went to take off my boots after having my patient robe on, he said, "Oh, no, it's okay, leave your boots on." And these were knee-high, high-heel boots. And I said, okay. I thought in my head, okay, he's protecting me because he knows I'm in an immune-compromised position and he doesn't want my feet on the floor. But later to know it was for his own gratification. And that was the date of the truly horrific assault.
That's just...
In a hospital gown, nightgown with high-heel leather boots. I mean...
He never had a nurse in the room with you?
I have never had a nurse present in any of my visits with him. The first time I ever saw him, there was a nurse that brought me in, showed me what gown to put on, where to put my clothes. She walked out after myself and him talking in his office for a good 45 minutes, and then taking me in where my exam was another 45 minutes to an hour. And I thought, wow, this is a very long exam. She walked out, and I never had anybody bring me in after that. There was never anybody present. He never had gloves on. And the 3 times that I did see him, every time I saw him, it became, the examinations were harder. They were more rough. They were more extensive. And I would make comments why is this hurting so much? This is really hurting. I would come up in my chair trying to get away from the ultrasound probe or from the pelvic exam. And it was always my fault because my anatomy wasn't proper.
Do you have a story or a question for me? Click the link in the description and tell me what in the world is going on.